Oxycodone is one of the most addictive pain medications. It hooks as many as 4.5 million. Listen to this statistic. In 2013, approximately 4.5 million individuals aged 12 and older reported past month non-medical use of prescription opioids. So non-medical use is recreational abuse. There are 4.5 for sure 12-year-old or higher citizens who are abusing prescription pills. These young people aren't even able to be prescribed them for their health. They are most likely buying or stealing. This will eventually turn out fatal or can be linked to higher risks of addictions of other kinds. A very unsettling statistic. This doesn't even include the adults in the population. This is just the younger generation and their abuse of prescription pills. This just goes to show how entirely addictive this prescription pain pill is. The fact that there are this many young people addicted and using just shows that we need to be more aware of this issue because it can have a fatal or very tragic outcome. Oxycodone is an important therapeutic agent in the treatment of pain. The reasoning for addiction of this pill can be because of self-medication of pain. In most cases, it is not because of pain. It is something that allows people to get high on. The high is a numb feeling that may signal pain treating, but these individuals most of the time do not suffer from any pain or experience any pain at all. Looking at addiction with logic helps implement recovery and prevention based off of reasons why someone might decide to take something. I look at it as to why they might have a reason to and what properties this pill has. The mean age was 17.7 years, ranging from 16 to 19 years old, and mean age at first abuse of oxycodone was 15, ranging from 13 to 18 years old. Overall, 56% of students reported oxycodone as their favorite prescription opioid to abuse. The primary preferred method of abuse of all oxycodone formulations was intranasal administration. 83% of single entity oxycodone abusers preferred intranasal administration, compared with 67% of combination oxycodone abusers and 69% of extended release oxycodone abusers. Approximately half of our respondents preferred to ingest oxycodone orally. 23 to 38% of respondents swallowed the pill intact, and another 13 to 17% chewed the pill before swallowing. Maximum dose ever abused at one time ranged from 15 to 400 milligrams. Most respondents had abused 60 milligrams of oxycodone at a time. This was a random survey that just goes to show how addictive this pill is and how it can be addictive to youth. This was a study conducted on surgical patients, and it says a total of 320 and 341 patients were evaluated pre and post intervention, respectively. Pre-intervention, 75.6% of patients were prescribed oxycodone. After review, 60.3% were supplied oxycodone. The median amount both prescribed and supplied was 100 milligrams a patient. Post-intervention, 68.6% of patients were prescribed oxycodone. After review, 57.8% were supplied oxycodone. Median amount prescribed and supplied was 50 milligrams. The difference in amount prescribed and supplied, 50 milligrams. After review of doctor-prepared prescriptions, reduced the proportion of patients who were supplied oxycodone but not the amount supplied and the patient. Having a pharmacist assist with prescribing reduced the amount of oxycodone supplied. So this shows the results varied from each patient based off of what the doctor thought would be best for their prescriptions, based off of if they thought they would get used to a higher milligram or if they would continue their prescription. Effects on the brain. The sudden withdrawal of oxycodone seems to have triggered the psychotic syndrome. A study on a patient that was conducted based off of the effects of oxycodone on the brain shows that it does harmful things to the brain. It causes this outburst of psychotic behaviors. The effect of this drug basically varies on each person, but was proven to have provoked this patient's outburst, and one might consider that before taking, and one might be able to assume that this drug altogether does horrible things to the person taking its mental state. When stopped or abused, and withdrawal symptoms can get more severe. Effects on the brain, part 2. Contrary to our expectations, Oxy did not affect behavioral or neurological responses to emotional stimuli in our primary areas of interest. Further, the effects of Oxy in the MOFC would be more consistent with a decrease in value for happy faces. This may indicate that healthy adults do not receive emotional benefits from opiates or pharmaceutical actions of Oxy differ from other opiates. Another study from my research I had found on Oxycodone and what it does to the brain shows that there is no benefit to the emotional health of adults. Using Oxycodone for emotional health is unnecessary because based off of studies, the pain it treats is physical pain. Opinions of possible solutions. In an interview and a study I read from my research about the possible solutions that could be taken, it is said that what I am asking them to do is look at the full health impact Health Canada has. Matthew says, federal health minister has a responsibility to set, and I think the policy has to be that you look at safety from a broader perspective. You don't just look at if this drug is properly taken, is it safe? Because we know this drug is not properly taken in many, many cases. I'm hoping that she will understand that this is not like any other drug I've never ever asked for this before. This is one drug that has caused way too much damage, and I just think that now we have an opportunity to get it off the streets. We must get it off the streets. Matthew says, I'm asking for an outright ban. Do not give it a notice of compliance. It is just too dangerous and devastating consequences. Based off of these answers, it displays perfectly how serious this drug can be, and the opinions of many on this drug is negative. Possible solutions, part 2. Another solution I found reading research was opioid overdose is a common complication of abuse, so it is desirable for an opioid vaccine to block the toxic as well as the addictive effects of opioids. It is important that an opioid vaccine not interfere with the action of opioid antagonists used to reverse opioid overdose or treat addiction. Some opioids are immunosuppressive, and chronic ongoing opioid use could interfere with vaccination immunity. Although antibody-bound oxycodone is unable to enter the brain because of its size, it might still be able to activate peripheral opioid receptors. In conclusion, suggests that vaccination might also reduce the severity of oxycodone overdose. In my opinion, if there has to be a vaccine against a drug because it's so deadly, we should take preventive measures and stay away from it. Based off of this research I found, I think it is necessary to refrain from using oxycodone and using it on patients. It is clearly a powerful drug and an addictive drug. I think that there are other pain pills and other mechanisms doctors could use instead of using oxycodone because it is such harsh of a drug. Thank you.